Hello there, Steve here with you again. I hope that you and your families are doing well and staying safe and healthy. This week I want to share two important updates on COVID-19. One on our vaccination effort for our people, and the other on wearing masks in the workplace. Now, we continue to work diligently to protect the health of our people while maintaining safe and efficient operations during the COVID-19 pandemic. And we're now finalizing a multifaceted employee vaccination effort. The new vaccine efforts involve the FAA providing eligible employees with a letter that states they meet the requirements of the CDC's Group 1 Charlie, and these are critical transportation infrastructure workers. Employees can present the letter to state and local health authorities that determine which of their residents receive priority for vaccines. Now, we'll begin by distributing letters to employees who are required to work on site at an FAA facility and cannot perform their duties while maintaining social distance, or those who interact regularly with the public or regulated entities as part of their duties. And next, we'll distribute letters to additional FAA people. Now, the FAA is also working directly with federal, state, and local partners to identify vaccine prioritization opportunities. For example, by working closely with New York State health officials, the FAA recently helped about 250 agency employees get vaccinated when unallocated doses nearing expiration became available. Now, according to the CDC, all COVID-19 vaccines currently available in the U.S. have been shown to be highly effective at preventing COVID-19. So if you're able to get a COVID-19 vaccine, I strongly encourage you to do so. Please do not rely on or wait for the FAA to make vaccination arrangements for you. The FAA's efforts are designed to supplement, not replace, state and local vaccination programs. Now, the FAA is also in discussions with OMB about the possibility of receiving an allotment of vaccines through the federal vaccine allocation process. We're simultaneously working to secure local partners and pharmacies across the country who can help us store and administer these potential vaccines to employees. However, I want to emphasize that while we work this possible avenue, the federal vaccine supply is currently very limited, and selected locations will be determined at a federal level. Now, these allocations do not take away from state and local administrations or change their priorities. As a result, the FAA will continue working with state and local jurisdictions to identify employees who might fall into a priority category to get the vaccine through state and local government resources. Now, as a reminder, FAA employees who hold an FAA-issued medical certificate or airman medical certificate and are able to get vaccinated should first coordinate with their management to ensure staffing and other operational priorities are maintained, because these employees cannot perform flight crew member duties or safety-related duty for 48 hours after receiving each vaccine dose. Now, as additional information becomes available on the vaccine efforts, we will share it with you. Now, it's also important to remember that employees who do receive vaccinations must still adhere to CDC guidance to wear a mask, wash your hands, and social distance. Those who have been vaccinated are less likely to become ill themselves, but they may still be able to transmit the virus to others if they happen to become infected. Now, we've also updated our guidance on face masks, aligning with the government mandate on mask wearing in federal buildings. FAA employees must wear face masks in common areas such as in elevators, hallways, and in shared workspaces, including open floor plan office space, cubicles, conference rooms, and operational areas. Face masks should also be worn in outdoor shared spaces when physical distancing cannot be maintained. Exceptions may be provided consistent with CDC guidelines. For example, when an individual is alone in an office with floor-to-ceiling walls and a closed door, or for a limited time when eating or drinking and maintaining distancing. Appropriate face masks need to be snug-fitting, cover the nose and mouth, and must be in accordance with current CDC and OSHA guidance. Non-protective masks, such as masks with unfiltered ventilation valves or face shields are not allowed as substitutes for face masks. Now I'll conclude with a reminder. Please continue protecting yourself and others. Along with wearing a mask, please social distance and wash your hands regularly. And if you're not feeling well for whatever reason, or if you develop any of the symptoms that the CDC identifies with COVID-19 or influenza, or if you're awaiting test results for COVID-19, please stay home. The health of your colleagues depends on you making smart choices. Now, we remain focused on making decisions that best support the agency's mission and prioritize your health and safety. Well, that's all for this week. Again, thanks for tuning in. Please take care of yourselves and your families. Take care of each other. Thank you for your dedication and service. And I'll talk to you again in a few days.